The annual population growth rate in Burkina Faso is 3.1%. At this rate, the country's population will double in 20 years. A leading contributory factor to this situation is the low rate of use of contraceptives, 15%. Hence, the unmet need for contraception is huge.
There were rumors in the village that women who spaced their pregnancies by 5 years would end up having twins. This was denied at the health post. Today, most women in this village are using contraceptive methods made available by the community distributor.
If this woman from a hard-to-reach community, which is not receptive to using contraception, is now convinced of the benefits of family planning and rejects all the misconceptions and rumors that surround it, it's thanks to a specific approach being implemented at country level within the framework of community-based services. Burkina Faso's Ministry of Health, with support from the United Nations Population Fund, UNFPA, has set up a system of community-based services which includes the community-based distribution of contraceptives. This approach is implemented as part of the contracting strategy, which enables the Ministry of Health to work closely with civil society organizations to better reach the communities. In this strategy, the Ministry of Health has signed contracts with NGOs and associations selected through a rigorous process. Another approach to facilitating community access to contraception is social mapping. Here we are in Mwaga. Community leaders have gathered around the head nurse of the health center to develop the social map of the village. This process, in which health workers and community members work together, helps everyone to identify and mark all the compounds in the village on a map, and identify the individuals living in each compound, particularly women. This map is then used by the community health worker to meet with women and men individually as part of community-based services, including the distribution of contraceptives. Berthe is in Mwaga. Using a social map, she visits compounds and holds personal talks with household members. The community health worker tries to meet the specific needs of all members of the community.
The facilitator came to our village and told us about the benefits of family planning, and we took his advice.
In the Tenkodogo Health District, the contraceptive prevalence rate increased from 32.67% to 36.36% between 2010 and 2011.
We will be talking about unwanted pregnancies among the...
In addition to using social mapping to implement community-based services, some NGOs specifically target young people, hairdressing salons to reach women, or bus stations to reach female street vendors and sex workers. The excellent partnership between health services and communities has yielded very interesting results. Community health workers have referred more than 21,000 people to health centers, and more than 390,000 contraceptive products have been distributed within communities. The number of new users per quarter increased from 75,000 in the first quarter of 2010 to over 156,000 in the fourth quarter of 2011. More and more people and communities are increasingly favorable to this practice. However, it has created enormous challenges.
The country is very large. There are many villages, and to date, we have covered only half of them.
The state budget has a specific budget line for family planning. This is a major step. However, this budget line needs to be regularly supplied to support the purchase of contraceptives. Currently, this budget line receives about $1 million, which permits to cover only about 30 to 40% of the needs in this area.
Community-based services within the contracting strategy in Burkina Faso have contributed to strengthening the synergy around family planning. But this strategy should be strengthened to reach more communities as a step towards delivering a world where every pregnancy is wanted.